Hey y'all, I'm Emily and I have the topic of allergies. So for an introduction to allergies, I have this video, but it kind of only talks about food allergies, but all the other allergies are kind of similar. Oh, I don't know what happened there. Oh, there it goes.
During an allergic reaction, the immune system responds to a normally harmless substance as if it were a threat. In some people, common foods such as milk, eggs, and peanuts can trigger such a reaction. So how does this work? If you have a food allergy, your immune system makes a type of antibody called immunoglobulin E, or IgE. This class of antibody binds to immune cells called mast cells and basophils that circulate throughout your body. When you are exposed to the food allergen, it attaches to the IgE antibodies. This binding signals the immune cells to release histamine and other chemicals that cause allergy symptoms, such as swelling of the lips, hives, and shortness of breath. Because mast cells and basophils rapidly release these chemicals, an allergic reaction typically occurs within 30 minutes after exposure. The most severe kind of reaction is called anaphylaxis, which can cause a sudden drop in blood pressure, trouble breathing, dizziness, and possibly death. People with food allergy and poorly controlled asthma are more susceptible to severe reactions. An anaphylactic episode must be treated with a hormone called epinephrine, which maintains blood pressure and opens up the airways. To deal with accidental exposure, people diagnosed with food allergy are prescribed a medical device called an autoinjector that delivers a single dose of epinephrine into the thigh muscle. Antihistamines alone are not an effective treatment for anaphylaxis. There is no cure for food allergy. The best way to manage the condition is to avoid the allergenic food, read food labels carefully, wash hands and household surfaces, and always carry an epinephrine autoinjector. If you are accidentally exposed to a food allergen, seek medical help immediately. The National Institute of Allergy and Infectious Diseases, or NIAID, conducts and supports research to better understand, prevent, and treat food allergy. In 2010, an expert panel sponsored by NIAID issued guidelines to assist healthcare professionals in diagnosing and managing the disease. These guidelines and a summary for patients, families, and caregivers can be found on the NIAID website.
So that kind of explained allergies. Of course, it just talked about food allergies, but most allergies work the same way. So there are 7 different types of allergies. The first being drug allergies, and these occur in a small number of people, and most of like the symptoms occur in like side effects of like swelling in the feet, migraines, hives, breakouts, that kind of stuff. Skin testing can be done to diagnose these kind of allergies, but usually a doctor just does it through like what kind of symptoms are you having and what's your family history. A food allergy is what the video just talked about in depth, and there are different types, and it could be an IgE medicated allergy, or it could be a non-IgE medicated allergy, or it could be a food intolerance. Lactose intolerant is a food intolerance, not an allergy. And the third type of allergy is insects, and it could be from like stings or just like being around them or touching them. The most common sting allergies are bees, wasps, hornets, yellow jackets, and fire ants. Non-sting insects, the most common are dust mites and cockroaches. There's also a latex allergy, which is a reaction to natural rubber latex, and it can be a serious health risk because doctors use latex gloves. You also use latex gloves at schools. So that could be impact students. They would need to tell their teachers it beforehand, and their teachers would need to accommodate them with a different type of glove if you're going to use latex gloves in the classroom. The 5th type of allergy is a mold allergy. Mold and mildew are fungi, and reactions can occur year-round, just whenever you're exposed to it. It doesn't really matter about the weather. The sixth type of allergy is a pet allergy, and pets with fur are the most common to be allergic to. And it's important to know that there is no allergy-free or hypoallergenic breed of dog or cat. They just don't exist. The seventh type of allergy is a pollen allergy. This is the most common trigger of seasonal allergy. It's also known as hay fever. The warning signs of an allergy attack vary from person to person, but the most common are tingling and itching in the mouth, hives, itching, and eczema, swelling of the lips, face, tongue, throat, and other parts of the body, wheezing, naval congestion or trouble breathing, abdominal pain, diarrhea, vomiting, nausea, dizziness, lightheadedness, fainting. The causes of allergies are allergens. Those are the things that you're allergic to. So for food allergies, the most common is milk, eggs, fish, tree nuts, peanuts, wheats, and soybean. And non-food is dust mites, insects, either bites or stings, or just being around them, pets, grass, weeds, pollen, and medication. Allergies can impact students in a couple different ways. The two most common are absentee students and decreased test scores, but also, as we mentioned earlier, having a latex allergy can impact students that are taking science courses or having to use latex gloves at school. For the absentee student one, Atlanta Allergy Foundation stated that 2 million missed school days each year are due to pollen allergies. That's not nationwide, that's just in Atlanta, which kind of like blows your mind that one city is 2 million missed days of school. The decreased test scores, there was a study that found that students with allergies scored lower on tests than students without allergies. It could be due to the missed school days. It didn't really say. The treatment and intervention for allergies, there's 4 different types. It's allergen avoidance, medication, immunotherapy, and emergency epinephrine. The most general and important in reducing reactions to people is the allergen avoidance. So that's when like people with peanut allergies will make a point to stay away from items with the peanuts in them. Medication is like the second one, and it could be inhaler, like an everyday inhaler or emergency inhaler, or it could be like everyday medications such as like Singular or Zyrtec. Then you could have immunotherapy, which is like in a series of injections of like the allergen in its like purified state, and it goes over a course of a few years, and it's kind of to like reduce your reaction to the allergen. For emergency epinephrine, it's also called an EpiPen. It's the most common with food and sting allergies. Additional resources for information on allergies. Mayo Clinic, you can go there to find like in-depth types of allergies or treatments or causes. And the ACAAI can answer any and all questions that you have about allergies. You can go there as a patient to answer them. You can go there as a parent. You can go there as a teacher. And they just have all these resources and answer questions. And I mean, there's even a thing on there that teaches you how to use an EpiPen. These are my references that I used to make this. If you want to read more on the way students are impacted by allergies and asthma, this one right here is the Allergy Atlanta Foundation, and it was like really in depth. It had tons of articles about how it impacts students' performance in school. And that's all I have. So, bye.